Hi, I'm Dr. Abbie Brooks. I'm one of the GPs here at Priory Medical Group. Just been thinking about the last year. General practice has certainly changed. It's an entirely different job than I was doing, let's say 15, 18 months ago. But I think some good has come out of it. The option of telephone, online or text video consulting has been a real benefit for some people, especially if they have work, childcare, caring responsibilities. They don't need to take the time out to A, try and book an appointment, and then B, come in and attend it. A lot of people have been confused about how to make an appointment and how to access us, whether we've been closed throughout. What I can certainly say is that we have been open. We've just changed how you can see us and how you can access us. A lot of practices have moved to a triage first model. Triage is basically a way of us being able to see all the work that we have and direct it to the right person, aiming really to get that patient to see the right person at the right time. So some places will do that using an online tool or a form that you have to fill in, and many practices will do that by phone, by giving you a call first, going through your symptoms and seeing if you would benefit or whether you need a face-to-face consultation. And there's many reasons why you would or wouldn't need a face-to-face consultation. If we need to examine you, then it's obviously best to come in and do that. But we do also have to consider that we remain in a pandemic. So if a condition or a problem can be dealt with over the phone, sometimes that is the safest and best thing for you. We continue to use PPE, so masks, aprons, etc., to see patients. Every time we see a face-to-face consultation, we then have to clean the room down in between. And of course, we also want to keep the reception desks and waiting areas as safe as possible. So we don't want lots and lots of people kind of in a small space. So that is another reason why, if we can speak to you over the phone, and then we can choose times that are sensible so that we can stagger some of that face-to-face contact, that's really useful as well. The other thing that you may have noticed about primary care general practice over the last few years is that there are other clinicians now. It's not just GPs, not practice nurses and HCAs, but also MSK practitioners, pharmacists, physician associates, and so much more. And I think that's really exciting. It gives an opportunity for our patients to be able to access more care, but also for highly specialised clinicians as well. So if you have a back problem, talking to a musculoskeletal physiotherapist is really beneficial for our patients. So how do you find out how you access your general practice? One thing I would recommend is certainly looking at your practice website. Some practices have a really active social media, so Facebook, Twitter, Instagram, and that's a way you can keep up to date and see, is there an online form you can use, or is it just telephone? Can you go to your reception desks and ask one of the receptionists? So that information should be available to you, and different practices do different things. There isn't a one-size-fits-all for general practice and for our patients. Different practice populations and communities will do entirely different things. It's been a really difficult past few months, I think, for us all, and we're seeing that in our increase in demand for appointments. There's lots of different people with lots of different symptoms, some physical, some mental illness, and we're trying to do the best we can to talk to and see as many of those patients as possible. It can be confusing as, do you need to go to a pharmacy? Do you need to go to the optician? Do you need a GP? And using NHS 111 if you're a little bit unsure can be really helpful as well. When we have spoken to you, we may say, actually, you don't need a GP. I will quite often say, our mental health practitioner or our physician associate would be excellent dealing with this problem. So don't be surprised if you don't get an appointment with a GP. That's okay. Other clinicians are really highly trained and have lots of experience working with us. We're all feeling a little bit tired and a little bit stressed, I think, across the nation, but certainly people working within the NHS. It's been a long and tiring year, so do bear with us and do be kind to the receptionists, to the call handlers, to the clinical teams. They're doing the best job they can. The last thing I want to say is that general practice is open. So if you have a new symptom that's worrying you, please don't delay in seeking some help for that. We have changed how we work and we continue to learn and develop. And over the coming years, I see general practice in a completely different light than 5-10 years ago. You know, you can do your shopping online, you can do your banking online. So having an option to move towards having some healthcare accessible online, I think is the right thing, but we just need to make sure that we don't have that as the only option. So do contact your surgery, do contact NHS 111 if you're worried about a new symptom.